Hi, my name is Esther Kim, and I'm the chairman of the website committee for the Society for Vascular Medicine. Today we wanted to take a little time to have an interview with the editor-in-chief of our Vascular Medicine journal, Dr. Heather Gornik, and talk to you about some of the new features of the journal and a collaborative project that we have together with the journal and our website. So with that, I'd like to introduce Dr. Heather Gornik.
Hi everyone.
Thank you for talking with us today.
Thank you.
So to get started, could you kind of give us a little bit of an introduction about the history of the Vascular Medicine Journal and how the transition from Boston to Cleveland has been?
Sure. Well, I think as many of you know, the journal Vascular Medicine has been our society's journal for many years. Its most recent incarnation is with Sage, our publisher, and Mark Krieger at Brigham and Women's Hospital and Joanne Normandin ran the journal for 19 years in its current iteration. We moved the editorial office here to Cleveland, Ohio in January, and it's been a busy and productive 2014. We've done a number of new things. We launched some new sections. We had a record number of submissions in 2014. I think we've kept our time to decision low, actually probably at new lows, which has been great. And importantly, we've developed a terrific and very engaged and committed editorial board and wonderful group of associate editors. Esther, I've really enjoyed working with you as an associate editor. We have a terrific team.
Well, it's been certainly a great learning experience for me, and we've been getting high quality papers, that's for sure. The other new project has been the release of a new cover. Could you sort of walk us through the new cover and what the symbolism is?
Absolutely, thank you. And if you get a chance to read this issue of the journal, there's a brief editorial from me which describes this cover and the symbolism of the different figures in detail. But basically, this was a collaborative project between the journal editorial office here in Cleveland, our publisher, and the society membership. We developed 3 prototypes for covers, and the membership voted on those prototypes, and this was by far the top vote getter. So this is what is arriving now in your mailboxes. First of all, we continue to have the table of contents on the back cover, but you'll notice we have a terrific new, fresher, modernized look. Gone are the traditional red and blue color blocks, although we pay homage to them with our logo here, still blue and red. We're going to feature some of the key articles on the front of the cover so people know what they have to look forward to, hopefully entice some new readers to pick up our journal and check out one of our articles. And then we have some carefully chosen images for the cover reflecting various aspects of vascular medicine, practice, and our journal. And I encourage you to read that editorial to learn a little bit more about why they were chosen.
Well, Heather, I think it's beautiful, and personally I voted for this cover as well. Could you walk us through some of the new features within the journal itself that you'd like to highlight?
Sure. We have a number of new things we've done in the journal since we've moved to Cleveland. I think one of the most exciting is the patient education pages. Natalie Evans and Elizabeth Ratchford have done really a terrific job taking common vascular diseases and creating patient educational materials written in relatively simple, easy to understand language. They've done 6 patient pages so far. There's now a patient page launched on varicose veins this month, and coming soon is Raynaud's phenomenon. But I think one really neat aspect of the patient pages is instead of them being peer reviewed by healthcare professionals, they're actually patient reviewed by a panel of patients to make sure they're understandable and to convey the key message as well. So the patient pages have been great. I think our society communication pages, the blue pages in the back of the journal, have been a way for us to really strengthen the ties between the journal and the society. Stay tuned for, I hope, more informative and also more interesting content and inside information about the society in the coming year. And then I also want to pass along that we're very excited about our focus issue. We're going to do our first focus issue. This year's issue is on venous disease. It will run in the April issue, the second issue, volume 20, number 2. And we have terrific, not only original articles, but some classic review articles on various aspects of thrombosis, but also things like thoracic outlet syndrome, venous intervention, varicose veins, venous wounds. So look out for that. We have also decided that our next focus issue for next year, for 2016, will be on aortic disease, and a call for papers should be forthcoming.
Fantastic, Heather. Those sound very exciting. And I look forward to seeing the April edition as well. I review many of those papers, and several were such high quality. I also did want to highlight that those patient education articles that Heather was talking about are also featured on our website.
Yes.
And if you go to our website, there is a link that will take you directly to the articles, and you can print them right from your clinic and hand them to your patients in real time.
And those are downloadable free of charge to everyone. That's content made available free from our publisher. So it's
fantastic. We spread the word. And then finally, do you want to talk a little bit about the new project that we are doing with the authors and the videos with the authors that we're putting on the website?
Yeah, no, I think this is another great opportunity for collaboration between the Society and the Journal. In many ways, the Society and the Journal are incredibly interwoven, not only the Journal being the official voice of our Society, but also many of us who are active in the Journal are also active in the Society. But what we're hoping to do is with each issue, highlight 2 or 3 of the most interesting articles, either original research or reviews or special articles, and actually have an interview with the authors produced by the SVM website team, with those interviews on the SVM website, hopefully out in the electronic media space. And we hope that this new form of communication will give us new avenues to get people to become aware of our wonderful articles and also our journal. And I should mention that we have appointed a social media editor for our journal, Ann Albers, who's an active SVM member, and she's been doing a great job tweeting out our content, and this we hope will be another tool in her kit to use social media and electronic media to spread the word and market our journal.
Fantastic, Heather. I think the new feature will definitely bring a new dimension to reading the article and provide some insight we couldn't otherwise get on printed paper. So with that, I'd like to thank Dr. Gornik for joining us today, and thank you for watching this video.
And I think we'll get back to work.